I've got a hypothesis, I want to try this out. It's called the alignment effect. If you come to me with a theory that, look, this is all I've tried, like you had the 9th neurologist, right? And he finally did what you asked and did your biopsy.
Right, yes.
Yeah.
18 years to
So,
get him to accept my suggestion.
yeah. I hate that.
Sorry, I'm taking it out on you, kind of.
That's okay, that's all right. I apologize for my colleagues. I believe that if you come to me with a plan that's not going to be fatal, and I align with that plan, it's going to be effective because you believe in it. So it's more than 30%. If the placebo effect is if I prescribe something and you believe in it. If you come up with something, and I've had countless patients. I mean, Bill, you're the shining example. I mean, Bill tells me what he needs. I try to determine if it's going to kill him or not. And if it doesn't kill him, we do that. Now that's different than treating hypertension and being the paternal imparter of wisdom to my patients.
See, you are way different than other doctors.
Way
different.
I am.
Because if I tell something to a doctor, I did my research, they say, I'm not comfortable with that. I hear that all the time. Not comfortable, not comfortable. And I'm going to lose it someday when I hear not comfortable. I mean, I just...
Yeah, well, it's not for your comfort.
Well, it's for my comfort, not theirs.
I know, that's what you say. But there's pharmacists that say that all the time. I'm
not comfortable,
I'm not
comfort
with
level, comfort this, comfort that.
Well, this is not about comfort. This is about taking a stand.
Starting to
for people.
rage, I better shut
Yeah.
up.
Make you comfortable when you're dying, so why would they want to make you comfortable when you're halfway alive?
Right, right. Yeah, this discomfort idea is, well, and here's the thing about treating patients with pain and why doctors are uncomfortable about it. First of all, doctors don't want to have pain. And second of all, the doctors that aren't comfortable haven't had pain.
Right.
Yeah, you gotta find a doctor.
Unless you've had pain, you don't understand it.
That's it. And the lawmakers don't understand it.
Yeah.
See, they think it's just dope. It's all dope.
Yeah.
Every bit of it. Pot, narcotics, and it's only for getting high.
Yeah.
And that's all they understand. And if that were
God
true,
forbid
then
you
it would
enjoy
be.
yourself.
Well, there is that. Yes. There is that. And of course, they're the same people who knock back 2 martinis for lunch. You know,
Well, that's good too.
Well, now they say, well,
the legislature runs on alcohol.
I believe it.
I was saying, speaking of legislature, and this is no complaint about the legislature, you know, it's like making sausage, right? I mean, it's like, what else we got? I have had so many patients in pain coming through my doors to my clinic that it looks like an epidemic to me. I called the state epidemiologist and I said, I'm having an epidemic in my clinic. All these pain patients are here. And the lady was great. We had a great conversation. She introduced me to the idea of using statistics and that sort of thing, so I'm going to follow up on that. But I got it that, you know, if it was influenza, we'd be down here with the medicines and we'd be immunizing everybody and blah, blah, blah.
Yeah.
If it was gonorrhea, we'd be hush-hushing it because the legislature's in town.
how about Ebola or something?
But because it's pain, it's like, well, that's not a communicable disease. I don't know if that's true. You know, I think pain dominates our lives, it dominates our families, it dominates our relationships, and it sure as hell's dominating my life. Like wave after wave of patient coming to me who can no longer get their prescriptions from their doctor who gave it to them for years.
Right. That's why it's happening to you,
That's why it's
because you're a
happening.
pain
Well,
doctor.
there's no one else to go to except for
And I'm
Right.
not a pain doctor, I'm just a kind of a MacGyver kind of guy. You know, it's like, what am I gonna do?
That doctor that testified at your hearing, I really appreciated his candor, because he said, I don't treat pain anymore because I don't want to have happen to me what's happening to you.
Yeah.
I mean, he flat out admitted, I'm not handling pain because I want to expose myself to what you're going through.
Yeah.
That had nothing to do with the Hippocratic Oath or pain treatment or patients or doctor, nothing. He was just saying, I don't want the law to harass me,
Yep.
so I'm not going to do what the current witch hunt is.
Right.
That's exactly what
Yeah.
they say.
And so he's not the only one. He just came forward. So who's left?
Well,
If you're in pain, you and I don't know who else. Okay?
But
Okay.
he's my doc who's not comfortable with anything.
Yeah.
Here, have a bunch of morphine. Oh, you read about something you wanna try? I'm not comfortable with that. Oh, you got advice from a Stanford neurologist? I'm not comfortable with that.
I didn't go to
You know?
school there, so I don't wanna know anything.
Well, there is something to that. If they went to school there, then sometimes they'll listen.
Yeah.
Especially the brothers.
First they came for the addicts, and I did not speak out, because I was not an addict. Then they came for the marijuana users, and I did not speak out, because I was not a marijuana user. Then they came for the healthcare professionals, and I did not speak out, because I was not a healthcare professional. Then they came for me, and there was no one left to speak for me.
That's right.
That's right.
That's,
And we are in a police state today, make no mistake about that.
I kinda think so. I mean, I'm like a tree-hugging liberal, I don't really talk that way usually, but this is like,
No, it's
this is
true.
weird. This is
And we're a war
weird.
machine.
You know, I mean, I've never seen anything like the insanity of how these things are progressing. And the reason I'm making a stand about it is that, well, first of all, I'm trying to save my own ass. But essentially, it's bigger than that. And if you leave it up to the doctor, and the doctor gets peeled off, then the next one who does it will get peeled off. And if there's 100 million patients in pain, then maybe thinking about it, something progressive will be done in terms of our own society, so that we will no longer categorize pain patients as criminals and just another scapegoat. We're fresh out of scapegoats, you know, we're kind of working through a lot of stuff in our society, so this is just a new way to scapegoat people.